Hello, everyone, and welcome back to another day of the pandemic, science, and society. I will be your first speaker of the day, and then we will have a professor from the law school. So I am going to share my screen, I think. Okay, great. So in this first hour, we are going to be talking about conservation and the environment as it relates to COVID-19 and pandemics in general. So I want to start in talking about this pandemic by pointing out that we are now on the 28th of August, 2020, in case you haven't been keeping track. And we're actually at the end of week 2 of the pandemic, science, and society. So today's lecture will be the last of the first 2 weeks. So I just wanted to orient you to where we are in terms of this pandemic. So I'll show you both the numbers for the global cases as well as within the United States. Globally, there have been over 24 million confirmed cases of COVID-19. Keep in mind, as we've heard from our speakers, that this does not mean that there aren't a lot more cases than this, because of course we've had issues with testing and with identifying all of the cases. But at least for the confirmed cases globally, we're at over 24 million. And you can see here that leading the way is the US with over 5 million cases. So on the left, I have data from the World Health Organization, and on the right, I have data from Johns Hopkins University. They have a dashboard. So if we look at deaths over here, the World Health Organization, and up here, Johns Hopkins, we're seeing that there have been over 800,000 deaths from COVID so far globally. Again, the United States is leading that, followed by Brazil, then Mexico, and India. These numbers are slightly different, and the reason for that is that they're pooled at different times. So for a lot of these dashboards, if you're tracking them, some of them will update at 3 a.m. each day, some of them at noon each day, and so on. So you'll see slightly different numbers, but obviously the general trends are the same. We can also look at the number of recovered cases globally, which is currently at 16 million. So obviously this is having a serious effect on our world, and the United States in particular has suffered a lot from this pandemic. So here on the left, rather than the World Health Organization numbers, I have the numbers from the CDC, and then we have the Johns Hopkins COVID-19 dashboard numbers on the right. So looking at the US, whether you look at the CDC updates or the Johns Hopkins updates, we have over 5 million, close to 6 million cases within the United States. Those are confirmed cases again, which means that the real number could be higher. And then we have 180 or so thousand deaths in the US alone, and 2 million people recovered from COVID. So this is something that's affecting the global population and the US population significantly. That's why we're having this class. That's why we're hoping to create a community of people who are committed to doing what is necessary for us to safely get out of this situation. So this pandemic is not separate from our interactions with the environment. So I want to talk to you today about the Anthropocene and the pandemic. The Anthropocene is the period in time that we are in on Earth, and it is related to the fact that human activity, we're in a time period on Earth in which human activity is significantly impacting the planet. So our actions are causing changes to the planet. And as you've heard from some of the other speakers, that is related to the pandemic. And so I want to walk you through some of those connections. As we've heard before, pandemics are increasing in frequency. So this information is not only relevant for the current pandemic, but for thinking about moving forward. And they're increasing in frequency as a result of what we do to the environment. So we must change our interactions with the natural world in order to improve not only this current situation, but also what will happen in the future. So how do humans interact with their world? There are some major categories that we need to be thinking about when we try and plan out how we will improve this situation. Habitat loss, including deforestation, is a major impact of humans on the planet. Also, climate change, which sometimes is caused by habitat loss, but from other things also, climate change has a significant impact on the Earth. Our food production, the way that we produce food, has an impact on the planet, as well as biodiversity loss. So the different activities that we do that cause species to go extinct, that has an impact on the Earth. And as we talked about yesterday, wildlife trade also has a negative impact on the Earth. But these things are related, right? So habitat loss can be a driver of climate change, but other things also impact climate change. As climates change, it then goes back and affects local areas and can impact habitat loss within specific areas. So those are connected. Habitat loss is driven by the ways that we produce food. And as habitats are lost, food sources are lost. So again, this is a back and forth relationship. That food production can lead to loss of biodiversity, and biodiversity loss, which then can impact disease transmission, can have an impact on our food production. And biodiversity loss is also impacted by the wildlife trade, and wildlife trade and biodiversity loss also lead back into these issues of climate change. And the reality is that all of these things are connected to each other. There's nothing, and all of these compound upon each other to create the situation that we are in. And that situation is unfortunately one in which all of these issues can lead to a pandemic. And that's exactly what has happened now. We have climate change, habitat loss, our food production systems, biodiversity loss, and wildlife trade that has led to a pandemic. And what you will see as I go through this presentation is that it is likely that we will continue to have additional pandemics in the future, just as we have in the past, related to these different issues. So as I've mentioned before, there are multiple publications that predicted a pandemic like this happening. And those same publications predict that we are going to continue to see these types of pandemics. So it's very important that we pay attention to these issues. Habitat destruction, which includes deforestation, but is not only deforestation. Habitat destruction puts humans and wildlife in repeated close contact. So we've talked about this before. The issue isn't that wildlife exists. That's not the issue. The issue is when we come into close contact with wildlife. That close contact allows non-human animal microbes to then cross over into humans and become human pathogens. That's what we're talking about when we're talking about zoonotic disease transmission. So habitat destruction, especially deforestation, lead to zoonotic disease transmission. Habitat loss also impacts the distribution of vectors. So some common vectors that we think about for different diseases are things like mosquitoes, ticks, fleas. And when you change habitats, it then impacts where those vectors exist. So that adds to this issue of disease transmission. And habitat destruction doesn't impact every species equally. Instead, we get this disproportionate impact on certain species. And what we see, for example, is that you have large mammals that decline faster than smaller species. So species like bats and rodents do better in these, they do better than large mammals in these disturbed habitats. And of course, we know that bats and rodents are some of the animals that we're concerned about in terms of spreading diseases. So rather than having these buffers of large mammals that, that help to reduce the chances that humans will get these zoonotic diseases, we instead are getting rid of those large mammals and increasing the amount of these potential disease vectors like bats and rodents. The large mammals play a role in eating the smaller mammals that can carry diseases. And so it's important, you know, that we have those large mammals available, and yet our actions on this earth are putting them at risk of extinction and also causing extinction of some already. And habitat destruction also accelerates climate change. It is certainly not the only driver of climate change, but it does accelerate it. This habitat destruction is happening in large scale because of multinational companies that are replacing forests with all sorts of things. I've listed a few here: soy, palm, cattle plantations, but there's lots of different things, and I'll go through some examples of things that are large companies are replacing forests with. I'm just going to look at the Q&A really quickly to make sure that you can all hear me and see me and everything else, because I'm seeing some hands go up. Yes, okay, great. All right, so we have these large multinational companies that are leading to habitat destruction. And there's also a serious concern about mining, which can destroy habitats through unsustainable practices. So agricultural systems and mining, these are two really big human activities that impact habitat destruction that I want to talk to you about. Though they are certainly not the only ones, I think they're good examples that we can focus on today. So when it comes to mining, there are all sorts of things that we mine that I'm sure you're aware of are really bad for the environment. Oil is one of them. Trying to get oil from around the world has all sorts of consequences for human rights, for wildlife, for the environment. It's a very negative effect on the planet. You may not be aware that gold also is associated with human rights issues and environmental issues and loss of wildlife. So for example, gold mining in West Africa is a serious concern because it has led to a lot of forests being cut down as these large mining companies move into small remote areas. And so there's been loss of forests. Those forests have historically been places where chimpanzees have lived. So there's, in one country, the chimpanzee subspecies that lives there has been nearly wiped out from gold mining. And so these sorts of mining practices can have really negative effects on wildlife and the environment. And they also have negative effects on the local people who suddenly have like these big corporations and a lot of activity in their communities. Gold is something that people don't often think of when they're thinking about conservation issues or how they can help. And yet it's something that many people purchase. And so it's good for us to be aware of these concerns and think critically about the types of things that we're using our money on. Another item that I can guarantee you every single person who is listening right now has purchased is coltan. And that's because it is the conducting agent in our electronics. And the need for coltan, the demand for coltan, of course, skyrockets when we emphasize getting the newest phone every year, getting the newest tablet, the newest gaming system, and so on. And so it's important for you to be aware that there are these products that go into the products that you commonly consume that are a huge concern. Coltan was in the news a lot, maybe 20 years ago as a serious concern. I don't know that it's in the news as much anymore, so I don't know how many people really know about it. But a lot of the mining of coltan happens in the DRC in Congo, and it's led to some really bad human rights violations. It's decimated some grade 8 populations and elephant populations. It's destroyed some natural environments. So this is a product that we are consuming that we can think about as consumers, about how to be more conscientious consumers, that really has a serious effect on wildlife. In addition to mining, agricultural practices are leading to a lot of deforestation. And for both mining and agricultural examples, these lists could go on and on and on, but for the sake of time, I'm just going to highlight a couple. One really important example for how agricultural practices are impacting wildlife conservation and the environment is through palm oil. You may be familiar with these large palm oil plantations that exist in Asia, where they are clear-cutting forest that's home to endangered species. And then they are doing these monocultures of palm oil. And that palm oil is in the candy that we eat. It's in our hair products. It's in our margarine. It's in all sorts of things. As consumers, we need to be really conscientious about looking at labels and seeing what's in the products that we're consuming, because the demand for palm oil has caused this huge conservation disaster in the places where these palm oil plantations exist. And for anyone who follows orangutan conservation, you'll know that these orangutans, which are a great ape species in Asia, their habitats are being destroyed at alarming rates. I mean, you can find images of orangutans that have been burned to death as they're clearing these forests. Or you'll find lots of videos of orangutans just like crawling through lumber that's been left behind after a forest has been cut down. So it's startling and it's really upsetting. And these are things that we're consuming on a regular basis. Another example of an agricultural practice that's really bad for the environment is beef production, keeping cattle for beef production. So for those of you who are interested in Amazon conservation, which I see some of you asking questions about that, cattle ranching has led to a lot of deforestation of the Amazon, and that's for the production of beef. So you have these foods that we're consuming that have this global impact, even though it's something that we're engaging with here in the United States or in wherever you happen to be. So in these, I'm giving an example of something happening in South America, something happening in Asia with the mining, two examples from Africa. Really, I mean, these effects on the natural environment are happening at a global scale, and we as consumers, wherever we are, then are part of this global production of these multinational, multi-billion-dollar businesses that are doing this work. Okay, so these large-scale agricultural practices, large-scale food production practices lead to habitat destruction, and that's a concern. They are a main driver of deforestation. They also lead to climate change, not just through habitat destruction. So again, remember I said these things are all compounding on each other. But a lot of our agricultural practices lead to the release of massive amounts of greenhouse gases, which then has a negative effect on climate change even beyond the habitat destruction. In terms of thinking about diseases, they produce large quantities of waste that can contain pathogens. So things like E. coli that exist in the waste from cows in the United States. That's a serious concern. And even beyond just producing waste and leading to this habitat destruction that puts people in closer proximity to wildlife, the animals that we keep as farm animals themselves have led to and will continue to lead to zoonotic disease transmission. So a few examples of agricultural animal zoonotic diseases that impact humans are measles, tuberculosis, and influenza. So again, it's not about pointing at the other and saying somebody else is doing something wrong, but really it's this entire system that we very much are a part of that we need to think about how to revise. Climate change itself is leading to a lot of issues for disease transmission. It's resulting from deforestation and other forms of human activity. I just mentioned that agricultural practices lead to increased greenhouse gases. I think everyone knows that our modes of transportation lead to increased greenhouse gases. So there are a lot of things that humans do that affect climate change. And then this leads to further changes of habitats at a local level through differences in local weather patterns, and also changes in local species. And climate change impacts the range of vector-borne diseases. So where mosquitoes can range varies as climate change happens. So this leads to the loss of species, which then upsets the balance of these wild areas and increases the chances of zoonotic disease transmission. As I was talking about before, when we're losing certain species but still have others, then there becomes this increased chance of zoonotic disease transmission. One of the species that's come up a lot when we've talked about these diseases, and in particular the coronavirus pandemic, is bats. And I've had students ask questions during previous lectures about why are bats always implicated in these disease transmissions, and also, like, what should we do about those bats? So bats are interesting because they are an asymptomatic reservoir for certain pathogens, and this is true of a lot of different animals, right? This is why zoonotic diseases happen, is because there are animals that are hosts of these pathogens that don't get sick from them. And then those pathogens, when they go into humans, can be really dangerous. So bats are this asymptomatic reservoir for a variety of different pathogens that can then be dangerous to humans. And importantly, as we're cutting down forests, all those bats that are living in the forest, and as we're destroying other types of habitats, they then go and roost in the cities, in the palm oil plantations, in the farms. And their saliva, their droppings fall on the animals that we're keeping for agricultural purposes. They fall on the foods that we're growing for agricultural purposes. So we have created a situation in which we're putting a pathogen-carrying animal in closer proximity to ourselves through our own doing, right? So this is not really the fault of the bat, it's the fault of humans for doing this to ourselves. So some people have said, all right, well, fine, let's get rid of all the bats. The short answer to that is no, definitely don't do that. You know, there is often this problem with people trying to solve one problem and ultimately creating 10 million more. That is absolutely what would happen if we got rid of bats. There's a significant portion of infectious diseases, including recent infectious diseases, that are vector-borne. And bats are really important for controlling those insect vectors that cause some of those diseases. So for example, mosquitoes are something that bats eat, and we rely on bats to eat them. And mosquitoes are a major vector of a lot of diseases that we're still dealing with regularly. It is estimated that by 2050, climate change will result in mosquitoes reaching 500 million more people than they do now. And that includes 55 million more Americans. So in other words, if we get rid of bats, we're going to be seeing a whole different concern over diseases because of mosquitoes in the coming years. So instead of just trying to solve the problem by further interfering with nature, instead we need to be thinking about ourselves as part of nature. And we need to reconfigure our approach to dealing with nature. We need to respect nature. We need to recognize how important it is for our own survival. And we need to include it as part of a holistic approach to how we deal with our own health. And there's a movement, there has been for quite some time now, for this One Health approach. And what the One Health approach says is that you have overlap between human health, animal health, and environmental health. And that by looking at all of these areas and looking at the overlap, we can actually come up with the best way to handle things like pandemics or preventing pandemics in the future. And you can look at this sort of schematic in a lot of different ways. There are many different ones that are available. But in particular, it's important for zoonotic disease transmission because, again, you have humans, animals, and the environment overlapping in a space where disease transmission can happen. So with animals, we're talking about both wild animals and domestic animals. They can trade diseases between each other. That can then cause issues for humans. And so at the middle of this, we have these different types of zoonotic diseases that we're getting because of these interactions between everything on the planet. And previously, we just haven't acknowledged or accepted the fact that we cannot control everything about our own health. And we need to have this holistic approach and deal with the deeper issues that lead to disease outbreaks, that lead to zoonotic disease transmission, and that lead to these pandemics. Another place that we could look to try and get ideas about better approaches to dealing with these issues are indigenous peoples. So for a long time, they have been fighting large corporations for protecting lands. And they have really been at the forefront of seeing the concerns that so many people have been ignoring about how destroying the environment has serious, serious consequences. I mean, it is indigenous people who acknowledge that climate change is happening because they're seeing it within their communities in such a dramatic way. They see how these changes impact health in a way that other people have been ignoring. So one example, just to bring this very close to home, is that Cargill, which is a company in the Midwest, has been destroying indigenous lands and the Amazon to produce agricultural products. And these are agricultural products that we're getting here in the United States, right? And so when we're thinking about, again, how we consume things and making sure that we're being conscientious consumers, we want to look at where products are produced, how they're produced, what the companies are doing in terms of how they're treating the environment, wildlife, and human rights. It's really important to protect the land and human rights of indigenous communities around the world. In fact, the UN Intergovernmental Panel on Climate Change says that this step is really vital to addressing the climate crisis. And since we know that the climate crisis is associated with pandemics, that means that focusing on protecting the land and human rights of indigenous peoples is also really key for protecting all of us from pandemics. I think also it's really important to keep in mind that we should be including indigenous groups in decision-making about forest policy and conservation efforts. This is something that governments and corporations have not been good about doing, but I would also say that even a lot of conservation organizations come in with the idea that they have the answer to something and they don't properly include people that they should. And as you've heard from me before, as well as Dr. Page, it's so important to work with local communities, make sure you're incorporating the knowledge of local people, and not thinking that you have the right answer, but instead working together to come up with a solution, or providing the support that's needed for people to come up with a solution. I think it's also very important that we recognize our role as consumers. So in addition to taking this One Health approach, in addition to supporting indigenous communities, we also need to recognize our role as consumers and be aware of the products that we're consuming. Wildlife trade, which we talked about yesterday, is a global economic driver of these issues. It's a global economic driver of environmental issues, and it's also a global economic driver of pandemics. And so we need to be thinking about that and how we can regulate trade and test products for pathogens within this global economic system. So, a lot of people, as we talked about yesterday, have called for just completely getting rid of any wildlife trade. I think we certainly want to reduce it, but as I tried to show you yesterday, in the United States, we consume wild animals. Seafood markets are really popular. Eating wild seafood is a popular thing. Lots of people, my family included, hunt deer and a lot of other things too. And so you have, I'm sure that if you told people in the United States, guess what, you're not allowed to hunt or consume any wild animals anymore, you would have a pretty big group within the United States that was not happy about that. And so we don't just want to be saying, no, well, in other places, they need to stop doing this. We need to think about how we can actually make an effective system for reducing pathogens through wildlife trade more broadly. And that means regulating it, testing products. We have to acknowledge, as I've highlighted in the previous slides, that our consumption of certain products is driving these issues. They're driving the environmental issues, which means they're driving our likelihood of future pandemics, and we need to be concerned about it. We also need to recognize that human-driven climate change is impacting these issues. So when we say we're not concerned about climate change, we're saying we're not concerned about future pandemics. And that's a problem, because I think at this point, everyone has been sufficiently inconvenienced to care about the pandemic. So this means that at the individual level, as well as government and corporate levels, we need to try and put in efforts to reduce the human impact on the climate. And because climate change it's the tidal wave that's already rolling, right? We need to put into some protections already, because we're not going to be able to completely slow it or stop it. So we need to have ongoing surveillance for illness in wild animals. There are lots of people like myself who already engage in this sort of work, but having the public at large know that that's an important thing and support us would be amazing, because guess what? There's not a lot of research funding that gets allocated for this sort of surveillance, even though we now know how important it is and how much it affects all of us. So having these things as a priority would really help us, would have helped us to hopefully deal better with the current pandemic, and hopefully will help us stop future pandemics. Because as you've heard so many times in this course, and I will say it again, this is not a one-time thing. These pandemics have been increasing in frequency, disease outbreaks have been increasing in frequency, and this is something we are going to continue to deal with for the rest of our lives if we do not start to seriously think about what is driving these disease outbreaks. So I've given a lot of examples from other countries, and I don't want you to think that here in the US we are just fine. In fact, the US has plenty of infectious diseases that we need to be concerned about. And I'll just give you an example of two that you may or may not be familiar with. So likely you've heard of Lyme disease. It is a tick-borne illness that's been an issue in the United States for a long time. It's been increasingly problematic because we've been destroying more and more of our own natural environment in the United States, which then increases the likelihood of humans coming into contact with these tick-borne illnesses. And in fact, now it's not only Lyme disease, we have just in the last 20 years, 7 new tick-borne illnesses that affect humans. And some of those are very deadly. So we need to be thinking about how we're interacting with the environment, even within our own country, and how we're creating situations in which humans are coming into closer contact with wildlife, and therefore increasing the chances that we'll get tick-borne illnesses. As you know, I travel a lot, I go to a lot of different places, and a lot of people say to me like, oh, aren't you scared to go to these places, and isn't it dangerous? And of course, there's always risks no matter where you travel. But I always like to tell people about when I worked at the Smithsonian Institution. After I graduated from undergrad, I was very fortunate to get a position in a conservation program at the Smithsonian. And part of what we did was exactly what I keep telling all of you to participate in, was training and working with local conservationists from different countries to help them do the conservation work that they were doing in their own countries. So we would bring together like 30 people from different countries to a 4-week-long training, and everybody would get to share ideas. They'd get to talk about the issues they were having, troubleshoot things. It was wonderful. I mean, I still am friends with a lot of those scientists and have visited them around the world. And they all came, one time there was a course that they all came to in the United States. And we had a great time. We were in a remote location and checking out lots of wildlife, talking about a lot of science. It was great. Everybody went back to their respective countries. And then we started getting some phone calls from participants who had gone back to their country, become ill, gone to the doctor. The doctor was unfamiliar with what the problem was, but they said that they had this like circle, kind of red circle on a certain part of their body, their leg or their arm or whatever. And we quickly realized like, oh no, there's an infectious disease in the United States that other countries aren't used to dealing with. And we just accidentally sent people back to their home countries to be cared for with this particular disease, and that's Lyme disease. So You know, there is no place on earth that is void of these dangerous diseases. And so again, it's not just about what's happening in other countries, it's also about what's happening here. So another example is West Nile virus in migratory birds in the USA. So West Nile virus exists in migratory bird populations in the US, but we have had a decrease in birds in the US over the last 25 years. And as I've mentioned on multiple slides already, not all species are affected the same, right? So species like woodpeckers have been more impacted by this decrease in bird populations than some of the tougher species like crows, for example. And these tougher species like crows can also handle having West Nile virus. And so you end up with this disproportionate amount of birds that are carrying West Nile virus. Okay, so once you do that, once you change the proportion of birds carrying West Nile virus, then all of a sudden you have an increased likelihood that a mosquito can bite a bird with West Nile virus and then go and bite a human with that will be exposed to West Nile virus. And so through these systems, we increase the exposure of humans to this pathogen. So again, just thinking about how all of this is interconnected and how we need to be aware of our own actions in order to improve the situation. So as I said at the beginning, pandemics are increasing in frequency, and it's a result of how we interact with the environment. But the take home here is not, let's just destroy all of the natural world. It's that we have to change our interactions with that natural world. So how can we do that? Conservation during this pandemic has been complicated, to say the least. As you know, before the pandemic started, we had this issue of plastics in our oceans. There are a lot of plastics in the oceans, and whatever you can do to reduce your plastic use, you should do it. Now we have even more plastics because of masks, gloves, and other safety equipment that is in plastic. So one thing you can do is use reusable when you can, but the reality is that there are a lot of things during this pandemic that we just don't have as much flexibility to do. So the other thing I would encourage you to do is to commit to plastic reduction when possible, particularly during the, what I'm calling the after, quote unquote, because I believe that I don't know what the aftermath of the pandemic will be. I don't think that we want to go back to normal. If this lecture has taught you anything, it's that we're not trying to go back to normal. We're trying to be better after the pandemic. And I don't even know if there's going to be a clear after, right? But there's some, whatever the space is, when we're no longer so limited in what we can do, really commit to reducing your plastic then, because I realize that we all have limitations right now. The other thing is that there's been a lack of surveillance during the pandemic on these wild places where we often have wildlife rangers and scientists and conservationists working. And because there's been a lack of surveillance, that means that there's been an increase in habitat destruction and an increase in illegal activities. Part of the problem with this is also because there are economic hardships on local communities. So when you have local communities that suddenly have lost their ability to participate in other types of work and whatnot, then that illegal activity that happens in protected areas increases. But importantly, it's not only these local people that are having economic hardship that are increasing the activity. You know, at this point, there's just lack of surveillance that means that different organizations can be destroying these habitats without people being able to oversee it. Another issue that has come to light as a result of the pandemic is the fact that we, for a long time, have been encouraging local communities to invest in ecotourism businesses instead of using local resources so that they have an alternative income and don't need to cut down the forest or hunt animals in the forest and so on. And yet now there obviously are no tourists going to be ecotourists in these places, and that has led to additional economic hardship. The other problem is that there is a real danger of COVID-19 being transferred back into wildlife. So we've seen this with other species. I mentioned before that Ebola virus was really had a very negative impact on some populations of gorillas. And similarly, we are particularly concerned about COVID-19 getting into non-human primates. Humans and other primates are so closely related that when we have diseases that affect us, they can also affect those species. And so I'll give you an example. Recently in the forest where I work, there was a common cold, a respiratory issue that was happening just with people around. And it's a common cold that humans have dealt with for a long time. And so people were not particularly affected by it, but then unfortunately it got transferred to the chimpanzee population in the forest where I work, and a significant number of chimpanzees died because of that. So remember, that's a virus, the same way that novel viruses are so dangerous to us because our bodies aren't used to them. If we give a novel virus to another species and their bodies aren't used to it, then they're very susceptible of dying from it. And so right now there's a lot of fear around what to do about non-human primates and the risk of them getting COVID-19. My own research in Uganda has been halted for the time being, just because we don't want people going into this forest where there are 13 species of non-human primates who could all be susceptible, and a lot of them are endangered. But there have been some positives that have come out of the pandemic when we think about conservation. And one of those positives is the fact that we have had reduced air pollution. So as I mentioned, our modes of transportation contribute significantly to climate change. And people have been noticing, even anecdotally, that air quality has been better. Suddenly people who live by mountain ranges in cities and have never been able to see the mountains can see the mountains, and those sorts of things. You also hear about clearer waters. Although the plastic issue in the oceans is still bad, some local waterways that no longer have boats that are releasing oil into them and those sorts of things have been improved. So there certainly are some positives. And what I want to encourage you to do is think about keeping up those changes during this after period, whatever that is. Because maybe we can see from this event how we don't need to be polluting our world as much as we have been. And then we could be working towards some of these improvements already so that we don't continue to have these pandemics constantly. So ultimately, I think the message here is that our activity in the Anthropocene, human activity, is driving these issues with conservation, issues with the environment that are directly linked to disease outbreaks. And those disease outbreaks have led to this pandemic and will lead to future pandemics. And we need to be aware of that and concerned about that. And I will say that in terms of positives, I think that one thing that has been true for decades is that people who work on these issues about the environment, climate change, species conservation, human rights, indigenous rights, those people have been screaming as loud as they can that we are walking into a disaster, that this is a catastrophe happening before our eyes. And unfortunately, because companies have been making money and multinational, multi-billion-dollar corporations are doing well, and because it's really difficult to have behavioral change, people haven't cared and they haven't been listening. And suddenly we have this moment in which people are listening because people have been inconvenienced enough that they do not want another pandemic to happen. And I am telling you, if you don't want another pandemic to happen, then you have to care about the environment. And in caring about the environment, we can help a whole slew of issues, from human rights issues to wildlife conservation issues, to the environment, to human health. And so I hope that this is a moment in which we can really change and not go back to that normal, but instead go back to a better way of interacting with the world after whatever it is happening, stops happening. Okay, so we are now at a point where I can take some questions, and there are a mere 424 in the question box, plus some sent ahead. Oh, I'm glad that 5 of you just hurried up and submitted some more questions for me. Okay, so let me see what sort of questions you have. I'm going to start. Yeah, so there's some questions about the Amazon, which I've seen quite a few of. So, you know, the Amazon is the largest rainforest. It's the largest forest in the world. It's extremely important when we think about climate change and preventing climate change. It's super important for biodiversity. It's really important. We need to be protecting the Amazon. And so I think some students are asking, like, how do you do that? As well as how has destruction of the Amazon maybe contributed to some diseases? So a few things. One of the questions was specifically about Zika virus, and if the Zika virus outbreak was at all related to destruction of the Amazon. And actually in this case, not. So Zika virus was originally discovered in Uganda in the Zika forest. That's where it's got its name. And I don't have time to go into it, but the story of how Zika virus was discovered is fascinating. Anyway, it existed in humans and wildlife in Africa and Asia for a long time before it arrived in the Americas, which we seem to have tracked pretty clearly to international travel. So it was brought by humans. Humans brought Zika virus to the Americas. It now may be in non-human primate populations in the Americas, which, you know, whenever the pandemic ends and I can ship samples back from Brazil and elsewhere, I will hopefully be able to answer. But that is not a case where destruction of the Amazon led to Zika virus. So I think it's a good question, and it's good to clear that up because, of course, these things matter, and it's good to keep that in mind. So in terms of conserving the Amazon, which some of you have also asked, I think that, you know, as I mentioned, being aware of what sort of products you're consuming. So there are a lot of efforts to support indigenous groups in the Amazon, as well as other organizations that are working towards protecting the Amazon. That's really important. And I would say if you know anyone in Brazil or any of the other countries in which the Amazon exists, which is, you know, across South America over into Ecuador also, that's where I work in the Amazon, their vote also matters, right? Government leaders really have an effect on how wild areas are protected. And in Brazil right now, there is this issue with the government not having a strong emphasis on protecting the Amazon. They say that they don't want to protect the Amazon at the cost of business. And I will tell you that there is like basically no way to protect the Amazon if your focus is on business. So yeah, I mean, again, your consumer dollars matter, your voice matters, being involved with these issues matters. Okay, so could you please explain again why decrease in bird populations increases the chances of birds spreading West Nile virus? Yes, so think about this. If you have certain species that can carry West Nile virus and just be around you and not be affected and whatever, and they're doing fine and their population size is growing, while meanwhile these other birds that don't do well carrying West Nile virus are dying off, all of a sudden you have an increased likelihood that the bird you are around could have West Nile virus. And then when a mosquito goes from that bird to you, it would increase the chances that you could be getting West Nile virus. So it's a proportions thing, right? By increasing the number of birds that are carrying West Nile, you're increasing the chances that a mosquito could then bite a bird and bite you. Hopefully that clarifies that. Okay, so in a few words, how is the environment directly related to the pandemic? I feel like I just gave a whole lecture on that, but I will reiterate. When we destroy the environment, we are creating a situation in which humans and animals are in close contact, and therefore zoonotic diseases can transfer between non-human animals and humans. Additionally, climate change changes where those disease vectors can spread, which also increases possibility of disease transmission. Additionally, by keeping animals as farm animals or wildlife trade and whatnot, we have close contact between humans and animals and can increase zoonotic transmission. So I feel like, I'm just saying everything I already said before, so I'm gonna move on from that question. Okay. So someone's asking if people's attitudes or government policies towards wildlife trade have changed since the pandemic. And, I think that's a really important question. I don't know how people's attitudes have changed. I think that we are missing the opportunity to get the message out that these things are linked. Because as far as I can tell from popular media, it's not a message that's been reiterated a lot. Although there are articles out there in the popular media about it, I just don't hear people talking about them as much. So I think as much as you can spread the message that these things are linked and we need to be concerned about it, the better off we would be. Government policies, it varies around the world. As I mentioned, China at least put into place this temporary ban, but a lot of countries haven't changed their policies. So that's an issue. Okay, so a question about seeing some decrease in pollution during the pandemic, and will that be a lasting effect? That's tough. We've been polluting the earth for a long time, and it will take a long time for us to overcome the effects of that. But what I hope we can do is see ways that we actually have come up with better ways to do things in this pandemic than what we were originally doing, and then keep up those behaviors afterwards, so that we can see these long-term effects after the pandemic is over, if that's the thing that happens. Okay, so a question is, if a virus such as COVID-19 transfers to other animal species, what is the best response for humans to help try and preserve that species? These are all great questions and very difficult. There's been a lot of debate in the field about how much intervention you provide. In the case of COVID, we have no intervention really for ourselves, so there's not much intervention that we could provide for, let's say, a gorilla that gets it. But, in some really highly endangered species like mountain gorillas, there's intense vet care for wild populations. There's intense patrolling to protect them. There's a lot of human activity around trying to keep them safe. And so in some ways, like for some diseases, you could see humans intervening for a very heavily endangered species to try and protect them. With the case of COVID, the approach has been to try and just do exactly what I'm telling all of you to do, which is reduce the chances that you come into contact with it. And so that's what we're trying to do with particularly great ape species, is really limit who can be in places with them, and limit the amount of time they're there, and also have really rigorous safety precautions. I know, at least for my field site in Uganda, that's been a big discussion among all of the researchers, the Ugandan Wildlife Authority, as well as the local people who work there. Okay, is there anything that we can do to try and reverse some of the damage we have done to our natural environment? Absolutely. So in addition to the things I said about trying to reduce the effects that we have now, so thinking about what you're consuming, thinking about the trash that you're creating, the amount of greenhouse gases you're producing, and all of those things, keep in mind that all of those things also at an individual level are important, but more importantly is you putting pressure on these government agencies and huge corporations that really drive these issues. And so that's where your vote matters, your money speaks, those sorts of things. In terms of what we can do to try and reverse it, one thing that a lot of people are doing is planting trees. So thinking about and it's not just go plant any plant anywhere, right? But thinking about the natural ecosystem that exists in a place, learning about the native species, and then being able to restore those places with those native species in a way that would have a very positive effect on the environment. Should we completely stop using the products that lead to habitat destruction? I will say that's probably nearly impossible to do. We live in a world where sometimes the products that we have access to are determined not by us, right, but by what the market is. But again, I think that being aware of this issue helps us to put pressure on the organizations and the government agencies and the companies that produce these products. So I'll give you an example, actually. Coltan, when I was an undergraduate, I took a class with who all called the famous John Matani. He is a primatologist from the University of Michigan, and he was my undergrad advisor. He studies the largest group of chimpanzees in the world. The group of chimpanzees that he studies has over 200 chimpanzees in this one group, and they're often featured in movies, so you've probably seen some of the chimpanzees that he studies. But he gave this lecture when I was an undergrad about coltan and how coltan was really bad, but guess what? There was this pressure on companies to not use this coltan that was mined in a really terrible way. And so companies started producing synthetic coltan. And some European phone companies started producing phones that were made with this synthetic coltan. If you can believe it, cell phones existed when I was in college. And so people started making this movement towards supporting this synthetic coltan. But ultimately, it was the markets that drove the decision. It was too expensive to create phones from the synthetic coltan than it was to, get this super cheap, unethically mined coltan. And so ultimately, those companies couldn't keep producing it that way. And I remember having a big emotional roller coaster as I first learned about coltan from this professor, then learned that there was something better and it was going to be okay, and then learned that ultimately, no, that didn't work out, and we're still relying on this unethically mined coltan. So, pressure on companies can do a lot. There's a lot of you, and you seem to have pretty big social networks. I also think that WashU students are just really incredible and able to take on the world. So I hope that all of you feel inspired to do something that makes a difference. Okay, somebody asked if I could explain the ecotourism issues in a different way. So the issue is that a lot of times, to try and give local communities a method of income that doesn't involve using the wildlife that they live by, we have been encouraging local communities to start ecotourism businesses where people from outside come in and then can stay and go on forest walks or go out in whatever type of habitat they're at, and so on and so forth. The problem is, in order for that business to be successful, you have to actually have clients that are giving you business, right? And in a lot of places that works out really well. Costa Rica is a place that has an incredible ecotourism business, and lots of people can survive on that business. But of course, at this moment where global travel is down, we're reducing, a lot of borders are closed, you don't have tourists going to these places, and therefore the people who are relying on that income no longer have that income. And that's a big economic hardship for them. And can I elaborate on disease vector? Yes, I think that will maybe be the last question. So a disease vector is an intermediary species that a disease has to go through, or a microbe has to go through, in order to get to whoever it's infecting. So for example, during the bubonic plague, fleas that bit rats would then bite humans, and the fleas were that vector that was taking the bubonic plague from the rats to the humans. Or in the case of malaria, mosquitoes are the vector that causes malaria in humans. So I think that I'm going to stop sharing my screen and stop talking about wildlife right now so that we can get ready to transition to our speaker in the second hour. But I appreciate all those questions, and I'll also go ahead and open up a discussion board later once I get the list of questions so that I can address some more of them, since we do have 600 questions now. So sorry that I couldn't get to all of those, but I'm sure you all understand. Okay, so it is now 2 o'clock, and I am very happy to introduce our speaker for the second hour of this class. So Professor Pauline Kim is a professor at Washington University's School of Law. She is going to be talking to us about the impact of COVID on workers and the workplace. Welcome, Professor Kim.
Thank you very much. I'm going to try to share my screen here. I have some slides. Okay, is that working? Okay, great. Well, thank you for inviting me. It's an incredibly interesting series that have been put together, and I'm sure the students are learning a lot. I wish I could attend more of them because I'm sure there's a lot that I could learn as well. So I teach at the law school, and my area of expertise is employment law, employment discrimination law. And so I have been interested in learning how COVID has been affecting workers and the workplace. And so on some level, I think it's pretty obvious. Everybody is familiar with the devastating effects that the pandemic has had on employment. In March, the stay-at-home orders were issued. It resulted in many businesses closing, a dramatic decline in employment. And so if we look at the unemployment rate, we see in April this huge peak, up to almost 15%. And in the following months, there's been a little bit of, it's gotten a little bit better as there's been a partial reopening, but we're still nowhere close to a normal labor market. Last week, 1 million new claims for unemployment insurance were filed in the US, and unemployment still remains at historically high levels. So this is a really obvious effect that the pandemic has had on workers and the labor market. But if you look a little more closely, just like if you look at the health effects more closely, you see that the employment effects are not evenly distributed. Low-income workers and workers of colors are the ones who have been most impacted by the pandemic. And ironically, there are two different and contradictory effects that impact these vulnerable workers. On the one hand, they are more likely to have lost their jobs. So if we break down this data and look at unemployment rates by race, you see that Black and Hispanic workers suffered much higher rates of unemployment, and their jobs have been slower to rebound as compared with white workers. So on the one hand, they're more likely to have lost their jobs, but on the other hand, if they have stayed employed, they are more likely to be in jobs that put them at risk of exposure and illness from the pandemic. So just like COVID has exposed inequities in our healthcare system, it has also exposed inequality in the labor market and the inadequacy and some of the gaps in existing worker protections. So I'm going to want to explore these themes in 3 different contexts that are related to the workplace. One is the safety net for workers. The second is workplace health and safety. And the third is worker privacy. So in terms of the safety net, workers have faced 2 major risks in terms of job instability because of the pandemic. So first, all workers have faced an increased risk that they might get sick themselves, or a family member might get sick, or that they might lose their childcare because of the school closings and the closure of daycares and so on. And if any of these happen, a worker risks losing work time and often therefore income. And then the second major risk is the one that we've already talked about, which is that the broader economic effects of the pandemic might cause a worker to lose their job altogether. So let's take the first one first, the first issue first. Under current law, employees have rather limited leave rights. There are no requirements that, oops, I'm sorry, lost it there. Just let me get back on the right slide. There are no requirements that employers provide paid sick leave. Many employers do voluntarily, but over 1/3 of employees have no access to paid sick leave. And many of those who don't have access to paid sick leave are most likely to be lower skill, lower wage workers. I think this chart suggests some of the differences. Black workers are significantly less likely to have access to paid sick days as compared with white workers. I don't have Latinx workers posted here, but their situation is even more limited. It's estimated about 45.9% of Latinx workers have access to paid sick leave. So what this means is that when the pandemic hit, workers were often faced with a choice. Do I stay home because I think I might have symptoms or because I need to care for somebody at home? Or do I just go ahead and take a risk and power through and go to work because I need the income? That obviously has consequences, that difficult choice has consequences not only for the employee, but also for broader public health concerns. Now, in terms of the family leave, the law provides only very limited leave to workers for family care reasons. There's a federal law called the Family and Medical Leave Act, which allows workers to take leave for the birth or adoption of a child or to care for a seriously ill child. But this leave right that's provided under the federal law is unpaid. There are only a handful of states that provide for paid leave. And it doesn't cover a situation like what many workers encountered during the pandemic, which is schools were closed, daycares were closed. That's not considered a covered reason under FAM law, so they couldn't take advantage of those leave rights for those reasons. So again, many workers were put in this difficult position, having to choose between going to work and earning the income they needed, but at the same time not having adequate childcare to take care of their kids, given all the changes that had happened. So in terms of job loss, our unemployment insurance system is a system that is supposed to provide a safety net. But the current system we have is inadequate to address the kinds of job loss and really the scale of job loss that we're confronting right now under the pandemic. So here's some basics of the unemployment insurance system. It is a state-administered system. It's actually a sort of a state-federal partnership, but states are the ones who are responsible for administering the claims, processing the claims, and in the first instance, they're the ones that fund the unemployment insurance claims. And what this means is we don't have one system, we have a patchwork of different state systems, and some of them are better run than others, some of them are better funded than others. In order to get unemployment insurance under our current system, the worker has to qualify based on their past earnings. They have to have earned a certain amount of time, certain amount of money over the past, say, year or so. And that amount of earnings will determine the level of benefits that they're allowed to receive, usually up to a certain cap on the total amount. Workers have to show that they lost their job through no fault of their own and that they're currently able and available to work and that they're actively looking for work. And the type of benefit that is provided is temporary partial wage replacement. So it doesn't fully replace the wages they have lost, and it's intended to be temporary, which means it's for a limited period of time. And that's because this system was designed to address short-term unemployment, the types of unemployment that occur when maybe a particular firm faces a temporary reduction in demand for its product, or when a worker loses their job through a restructuring and needs a few weeks to find a new job that's suitable. This system is really not well suited at all to deal with the kind of nationwide crisis like the one we are experiencing with the pandemic right now. Now, even before the current crisis, the value of unemployment insurance benefits have been declining, in part because of increasing requirements that are put on workers in order to qualify, but also because of reduced funding levels by the states. Now, the system, as it exists, often fails to provide adequate support for the most vulnerable workers. Low-wage workers, those who are in contingent jobs, they may not earn enough money to even meet the basic eligibility requirements. And even if they are eligible, their benefit levels, because they're tied to their prior earnings, will be lower. And so those workers are often the ones who are living closest to the poverty line already and are getting the lowest level of benefits. Once again, Black and Latinx workers are particularly vulnerable, and they are less able to weather the serious impacts that come from job loss. On average, workers of color, compared with white workers, have faced far greater job instability, which means they have experienced more intermittent earnings, and that makes it harder to save. They also have lower levels of household wealth, and they spend a higher percentage of their income on housing. And all of these factors mean that even when they do receive unemployment insurance benefits, they are less well able to weather that economic shock involved in a job loss. Now, our current unemployment insurance system is inadequate in another way. As I mentioned, UI is state funded. States cannot run a deficit. And the pandemic is not only raising demands on these state unemployment insurance funds to unprecedented levels, it's also depleting state resources because states are facing falling tax revenues as a result of the business closures, and they are also having to increase their expenditures for public health measures to try to contain the virus. So what this means is that the normal safety net that we have for unemployed workers just isn't working in this context. States simply don't have the resources that they need to provide the support for workers in order to get them through the pandemic and through the economic crisis that it has caused. Now, it is these gaps in the safety net that were noticed and led Congress to step in earlier this year. And Congress did so by passing two major pieces of legislation, the Families First Coronavirus Response Act and the CARES Act. Both of these pieces of legislation did a lot of things in a lot of different areas, and I just want to focus on the impact that they had and the extent to which they were addressing issues in the workplace. So looking first at the Families First Response Act, there were two important things here from a workplace point of view. Employers were mandated under the Act, or are mandated under the Act, to provide 2 weeks of paid sick leave to their workers, their employees, for any COVID-related reason. So if they are sick themselves, they have to care for a sick family member, or if they're under a medical order to self-quarantine, any of those would qualify, and they would be entitled to receive 2 weeks of paid sick leave rather than having to take the hit in income themselves. And the second thing the Act did was to expand the availability of leave for childcare reasons. And so both of these provisions, I think, are a step forward, a recognition of a weakness or a gap in the safety net, but they're somewhat limited in what they accomplished. The paid sick leave provision only applies to firms with between 50 and 500 employees. So that left a lot of employers uncovered, both at the small end and at the large end. It's been estimated that somewhere between 7 and 20 million private sector workers were excluded because of the firm size exclusions in the statute. And the family care provisions, while they do provide for leave, the leave is only partially paid. I think it's up to 2/3 of the prior wage and up to a certain amount that's capped. And it's only for a certain limited number of weeks. Both of these provisions are also time limited. So unless Congress acts again, these leave rights will expire at the end of this calendar year. So the CARES Act, the other major piece of legislation that came out of Congress, dealt with the unemployment insurance system. So that legislation provided that all workers could receive an additional $600 per week in unemployment insurance benefits regardless of their previous earnings. And this was very important in terms of raising the level of benefits, particularly for those low-wage workers that I talked about earlier, who might not have a lot of a record of high level of earnings, which would affect the amount of the benefit. This was intended to deal with that issue. Now, as you probably heard, the funding for that $600 per week, the federal funding for that $600 per week supplement ran out at the end of July. And Congress has been trying to determine whether or how to extend some kind of supplemental federal aid for the UI system, but they have been deadlocked in terms of what additional support should be provided. So no additional federal funds are available right now. Congress is in a complete deadlock over this issue. The other notable thing that the CARES Act did from an employment perspective was to extend unemployment insurance benefits to self-employed workers. Because UI traditionally only applies to a traditional employee, somebody in a classic employment relationship with an employer. Now, this provision is important because in recent decades, firms have been shifting away from a model of relying on full-time workers to get their work done towards a model that relies more heavily on temporary workers and workers that are considered to be independent contractors. And this is sometimes referred to as a shift towards contingent work, where there isn't this stable employment relationship, but kind of a more of a contingent, temporary or contingent relationship between the worker and the firm. And this is most, I think, most clearly exemplified by workers in the gig economy. So all of these companies, many others as well, are increasingly relying on workers whom they call independent contractors. So the delivery workers and the drivers who work for these companies, they don't have a traditional employment relationship with these companies. Instead, they sign up by signing a contract with a company, and then when they want to work, they go to an app, they sign onto the app, they're given assignments, they can work for as little as long as they want, on whatever schedule they want, and they are paid simply by the amount of work that they perform. Now, some workers might find this arrangement attractive because it's more flexible in terms of the number of hours they work and when they work, but this arrangement also contributes significantly to workers' economic insecurity. And the pandemic really exposed that vulnerability of the contingent or gig economy workforce. Like other workers, they face the same types of dilemmas. If they had symptoms, should they continue working or should they stay at home? But they also face the risk of losing income if they chose to stay home. And even though Congress in the legislation mandated paid sick leave, none of these workers will be eligible for that paid sick leave because they're not considered employees of the platform companies that rely on their labor. Now, some of these workers have also sustained really significant economic losses. For example, when the stay-at-home orders were imposed in the spring, the demand for ride-hailing services plummeted, and thousands of Uber and Lyft drivers faced steep declines in their income. Even if they were willing to work and to put in the hours, there simply wasn't the demand for their services. And because they only got paid for each job, or in their case, each ride completed, their source of income had dried up. And because they are not employees, they were not eligible for traditional unemployment insurance. And once again, the costs of this income insecurity is not evenly distributed. Women, people of color, and immigrants are overrepresented among gig workers and other forms of contingent work. And the pandemic really made clear how vulnerable these workers are to this income volatility. Congress tried to respond by creating that special category of an unemployment benefit program for self-employed and gig workers that I mentioned earlier as part of the CARES Act. And that's certainly an important step forward and a real recognition that these workers deserve to be included in some way in the broader safety net. But that particular program, the extension of unemployment insurance benefits, has been plagued with a lot of delays and technical difficulties. States which were already facing enormous demands on their resources, faced a really significant problem getting their computer systems to be able to deal with what was essentially a whole new and separate benefit program. And there was a lot of pressure for them to act quickly and make these benefits available to the workers. On the other hand, the federal government had made clear that if states distributed these funds in a way that the federal government viewed as inappropriate or fraudulent, they would be on the hook for all of the money that the federal government had contributed. And so they were really caught between these competing pressures of acting quickly, but then trying to get it right so that they didn't end up with a big bill of their own and down the road. And because of all those problems, it's not entirely clear the extent to which contingent and gig workers overall have benefited from the unemployment program. In any case, these benefits will expire at the end of this year as well, unless Congress acts. So the second topic I wanted to talk about is workplace health and safety. So we've been talking now first about workers who have been struggling after losing their jobs or their source of income. For many other workers who have remained on the job in positions that are considered essential, they face a different set of risks. If they can't work from home, very often their jobs entail risks of exposure to infection and possible illness, because many of the jobs, the essential jobs in our economy, are ones that require face-to-face interaction. Jobs, for example, in healthcare, elder care, mass transit, and food production and supply. And these positions, once again, are held disproportionately by vulnerable workers, low-income workers, workers of color, and immigrant workers. So a few more stats again. Black workers are overrepresented in essential jobs. They make up less than 12% of the workforce overall, but are about 17% of frontline workers, as you can see from the top two lines of this chart. And the bottom part of the chart shows how they're distributed over some of these essential jobs. For Hispanic workers, the numbers are distributed somewhat differently across the different industries, but the basic pattern is similar. They are overrepresented in these frontline jobs. So when these workers confront work environments that they believe pose threats to their health, they have a limited number of options. And I want to talk a little bit about the challenges, and I want to do so by focusing on the meatpacking industry as an example. So you may be aware that there have been a number of coronavirus clusters that have been traced to meat packing plants. There was one Smithfield plant in South Dakota, I think it was back in April, recorded nearly 800 cases of COVID among its employees, and then a couple hundred more cases in the community were traced to contacts with workers at that plant. At one point, over half of all of South Dakota's recorded COVID cases were connected with this plant, and it eventually had to shut down for a number of weeks. But it's not the only one. There have been other meatpacking plants in other parts of the country where clusters have emerged, and plants have had to close for several weeks while workers were sick and to engage in deep cleaning and so on. But the vulnerability of workers in the meatpacking industry predates COVID. And once again, the pandemic has made those vulnerabilities more visible. So work in the meatpacking industry is dangerous under the best of circumstances. It involves heavy labor in cold temperatures and the use of dangerous cutting tools. Workers work shoulder to shoulder on assembly lines. They have little control over the pace of work. They often are wearing bulky protective gear. They have to lift heavy items. They may be walking across slippery floors. The work is grueling and repetitive. And even before COVID, this injury already had high injury rates. Because of the poor working conditions, meat packing plants often employ more vulnerable workers, those with fewer skills and fewer options, again, mostly workers of color and immigrants. I think about 44% of frontline meatpacking workers are Latinx. More than 30% of them are immigrant. Some of those workers are undocumented. And it turns out that those difficult working conditions, close worker contact next to fast-moving assembly lines, also makes these plants prime locations for the spread of COVID. Workers have complained that their employers did not provide sufficient protective equipment or sick leave. They've alleged that they were required to work in close physical proximity to one another, that breaks and shifts were not staggered, so that the narrow hallways and the very small bathrooms and break rooms were very crowded during break times and shift, the passage times between shifts. The meat companies have refused to slow the speed of the lines, which would have allowed them to space out the workers more. Some companies have reportedly offered their workers substantial bonuses if they have perfect attendance records, if they don't miss a single shift for any reason, which encouraged many workers to continue working and to ignore symptoms. By mid-June of this year, it was reported that nearly 27,000 meatpacking plant workers had caught COVID-19, and about 100 of those workers had died. Those are the numbers I found from mid-June. It's probably higher today. So when workers feel that their working conditions are not safe, what legal recourse do they have? It turns out that their legal options are rather limited. The Occupational Safety and Health Administration, which is a part of the Department of Labor, is the federal agency that is responsible for ensuring safe workplaces for all Americans. It pursues this mission in two principal ways. First, it issues regulations that set health and safety standards. And second, it conducts workplace inspections, and it can impose penalties and make remedial orders if it finds that an employer is operating an unsafe operation. So the agency often has to depend on workers or unions to raise complaints about unsafe conditions in order to trigger an inspection. Now, there are several problems with this enforcement system. First of all, developing those regulations to set standards is an incredibly long and complicated process. It often takes years, sometimes decades. There have been instances of OSHA regulations that have taken so long to actually finalize that they're practically obsolete by the time they become final. And the process is just not suited to responding to a fast-moving emergency like the pandemic. The agency can issue temporary emergency standards, but so far, this administration has not issued any such standards to deal with COVID. It has only issued non-binding guidance to help employers, but employers are not required to follow them. There's no legal mandate that they follow those guidances. This inspection process that OSHA has, the second sort of prong of what it does, has been hampered by a lack of resources. The number of OSHA inspectors has always been pretty low compared with its task of ensuring that all American workplaces are safe. And the Trump administration further reduced the number of inspectors and the resources available for conducting OSHA inspections. So today, the agency conducts about 25% fewer inspections than a decade ago. There are fewer inspectors today than there were 40 years ago, even though in that same period of time, the size of the workplace of the workforce has almost doubled. And if you put together the federal inspectors with state offices that do workplace inspections, there are maybe about 2,000 inspectors throughout the country, and they're responsible for ensuring the safety of over 8 million workplaces. With the pandemic, the number of complaints that have been raised and the requests for inspections have grown, and it's simply overwhelmed the available resources for conducting inspections. So although OSHA relies on worker complaints to identify potentially dangerous work sites in order to guide their inspections, workers are often reluctant to complain out of fear of retaliation. And particularly when you have a heavily immigrant workforce, as you do in these meatpacking plants, Their ability to complain may be hampered by language barriers or by a lack of awareness of their rights. And when the workers are undocumented, they are particularly unlikely to raise a complaint. So in theory, the law protects workers from retaliation if they raise a workplace health and safety concern, but many workers simply can't afford to risk losing their jobs or being reported to immigration authorities. If a worker does lose their job in retaliation for raising a health and safety complaint, their recourse is to file a whistleblower retaliation complaint. And they are required to do that by filing it with OSHA, that same understaffed agency. The Department of Labor Inspector General recently conducted a study and reported that whistleblower retaliation complaints that are filed with OSHA have increased significantly during the pandemic, but the number of staff to investigate those complaints of retaliation has been decreasing, and so there are even longer delays in responding to those situations. So if a worker is not willing to rely on the agency then to protect them, do they have any other recourse? Well, if they belong to a union, they have a better chance of successfully negotiating workplace conditions. Health and safety issues are the type of working condition and the type of issue that's at the core of what unions bargain about. And so the union can provide a mechanism for workers to raise concerns collectively about safety on the job, and can also shield the individual worker from having to step forward alone and potentially be subject to retaliation. Collective action is also an option for workers who are not represented by a union. Federal law protects workers who engage in concerted activity. They are protected against retaliation by an employer as long as the aim of that concerted activity is to address a core working condition like health or safety. So if they join together to raise these concerns, even if they don't have a union, they are legally protected against retaliation. Although again, the process of filing the complaint, if they are retaliated against, and having it investigated and getting their jobs back can be quite a long and uncertain process. The other limitation is that even though the law protects workers against retaliation for concerted activity, it doesn't require the employer to make any changes in response to those collectively raised concerns. So given the limited options that are available under OSHA and the labor laws, some workers and their advocates have been trying to be a little more creative. So for example, a couple of months ago, a lawsuit was filed against a Smithfield pork processing plant in rural Missouri, which sought a court order that would require the plant to comply with the safety guidelines that had been issued by the CDC and by state public health officials. And rather than relying on labor rights or on OSHA, the lawsuit instead alleged that the plant was a public nuisance, that by operating without adequate safety procedures, it was threatening the health and safety of the workers and the surrounding community. And the lawsuit was filed in order to try to force the company to provide better protective equipment to the workers, and also to prevent them from discouraging workers from taking sick leave when they felt ill. There were a number of other issues they raised as well. Some of the issues I talked about earlier in terms of trying to affect spacing of workers on the job, slowing down the line, and dealing with crowding in the break rooms and so on. But a federal judge dismissed the lawsuit on the grounds that the issue of workplace safety was really a matter for OSHA, not one for the courts. Nevertheless, the employer appears to have changed some of its practices, apparently in response to the suit. So even though they weren't able to proceed in court, it did appear to have some effect. Now, these similar types of lawsuits to this have been brought in other courts throughout the country, and some of them have been permitted to move forward. There's even a case in California where a state judge issued an order requiring a McDonald's in Oakland to provide adequate protective equipment to its employees. So these types of lawsuits, like I said, they're a bit of an innovation. They're kind of a creative effort to try to bring some pressure to bear on the employers. At the moment, these appear to be one of the few avenues that are available to workers to try to force employers to implement safety protocols when they feel that their workplaces are unsafe and that they are unprotected from COVID. But it is precisely these types of lawsuits that Senator Mitch McConnell has vowed to prohibit. I mentioned earlier, Congress is in a stalemate right now regarding new legislation to alleviate the economic effects of the pandemic. One of the sticking points between the two sides has been the insistence of Senate Republicans, led by McConnell, that any new coronavirus relief bill must include a provision that immunizes businesses from lawsuits like this, where workers might try to force employers to comply with existing safety guidance. Okay, so the third topic I was going to talk about today is employee privacy. This is another area where I think COVID is likely to have an impact. There are relatively few legal restrictions on employers' ability to collect information about their employees and to monitor their activities. And what's happening with the pandemic is that there is increasing motivation for employers to gather information about their employees and to try to track their whereabouts and their activities. So, for example, employers now have a greater interest in monitoring their employees' current health and potential exposures in order to prevent infected employees from entering the workplace. Health questionnaires and temperature checks have become quite common. Practices like these, I think, probably make a lot of sense in the context of a public health crisis. But the danger is that infringements of worker privacy will start to exceed what is justified by public health needs or will persist beyond the current crisis. So privacy experts sometimes talk about something called use creep, and that's when a practice or a technology collects personal information for a legitimate purpose, but then the entity that's collecting the information starts to use that information for other purposes, which may be less justified. So to consider some of the issues that may arise in the context of the pandemic, some employers want their employees to install contact tracing apps on their phones. That can help provide information about when a worker has been exposed to the virus and might be at risk of illness or infecting others. But it raises questions. Should the employer be allowed to require employees to activate the app at all times, even when they're off duty? Should the employer be allowed to have access not only to information about whether an employee had a potential exposure, but also able to access all of the underlying geolocation data that many of these apps rely on? What if that geolocation data is revealing information about what the employee does off duty, who she associates with, what establishments she visits, and so on. Another technological change that we are starting to see is some employers using cameras and facial recognition technology in the workplace in order to detect if workers are violating mask requirements or are not physically distancing. But that same technology can also be used to analyze, the facial recognition technology can be used to analyze workers' emotional states and health status. The technology can be used to impose other kinds of discipline through surveillance of the workplace, and it can be used to record or keep track of which employees are talking to whom and who therefore might be involved in raising complaints or being involved in a unionization effort. Now that many employees are working from home, a lot of employers are concerned about how to ensure their employees are productive. And so some employers have started to require employees install productivity monitoring software on their computers so that their supervisors can monitor their activities at home. Some colleagues at the business school here at Washington University have been conducting a study to explore the use of surveillance tools by employers. The co-authors, Vashist and Elfenbein, surveyed 668 workers who have been working from home and found that there has been significant increases in different kinds of employer monitoring practices after the pandemic began. So for example, employers requiring that their workers keep their webcam on all or most of the day when they're working at home has gone up 6% to 16%. Similarly, the requirement that workers use computer monitoring software that indicates how many minutes they're actively working and when they're idle has also gone up significantly. And in this study, they have have asked workers about a number of different surveillance practices like this and have noticed a pretty consistent uptick in the adoption of these practices by employers. They're still in the process of analyzing the data, so these are only preliminary findings, but it appears that Black and Hispanic participants in the survey are reporting that they're subject to more surveillance by their employers than their white counterparts. So once again, there's concern that these types of monitoring activities will bear more heavily on already disadvantaged groups in the workplace. And the overall risk is that this type of surveillance, which may seem prudent in times of a pandemic, may come to be normalized, such that intrusive monitoring and extensive information gathering about employees continues even after the public health crisis has abated. Okay, so I want to just conclude by saying that these are just sort of three areas, but in many ways, the pandemic has had really significant effects on workers and the workplace. And these effects have exposed the weaknesses and inequalities that have existed in the workplace long before the pandemic. And so while it is sobering to see how much harm has been inflicted, how much economic harm has been inflicted by this virus, it also provides us an opportunity to better understand and recognize existing problems of workplace inequality and worker vulnerability, and to start taking steps to create safer and more just workplaces. So I'm going to stop there, and I'm happy to take any questions. How are we doing this in terms of the questions?
Yep, I've been compiling a list of common themes that the students have questions about. So I'll just ask you and then you respond, and we'll go back and forth until we run out of time. Okay. So thank you for that. That was really wonderful. And since you ended on the note about how we can be thinking about these issues during this time and then making changes, several students had questions about if there's any positives that you see having come out of this, like any of the acts that have been put in place or other changes related to unemployment that would be good to continue after the pandemic ends.
Yeah, so I mean, it's difficult to say good has come out of the pandemic, right? But you know, when I was talking about the CARES Act, the two pieces of legislation that Congress passed earlier, the fact that Congress even took those steps, even though they're partial and they're temporary, they do represent a recognition, a public recognition that these are problems, right? That people, you know, a third of the workforce doesn't have access to paid sick leave. That's a problem all of the time, particularly for lower income workers, but it wasn't a very visible problem, right? The same thing with gig workers. If something happened to a gig worker and they lost their source of income, they wouldn't be eligible for unemployment, but it wasn't a very visible problem until this pandemic happened and really affected large swaths of those gig workers that brought the attention to policymakers. So I think that that is sort of a small positive step, that there has been recognition of these gaps in the safety net, but because what Congress has done so far is partial and temporary, whether or not it's really a positive will depend upon whether we can take that public recognition of those problems and turn them into more permanent solutions.
I think that's good to know. And I mean, yeah, I think a lot of students are struggling with it seems like the pandemic is going to be continuing on and on and on. So to what extent, I mean, you mentioned some deadlines of 12/31 for some of these. Is this the sort of thing where it's going to go back into a debate and there's going to be a gap between coverage, or do you think that'll be extended?
Yeah, so I don't really know. I mean, certainly with the supplemental benefits, that extra $600 a week, there's a gap now, right? Mm-hmm. At the July 31 that supplement from the federal government is gone. And that's, for the workers who were depending on that, that's a big hit, right? And so we already have a really significant gap. So it's a little discouraging that they haven't figured out, and I understand there's a lot of policy debate about whether 600 is the right number. One of the effects you might have heard about was there are some workers who were paid so little that getting that $600 a week supplement actually meant they got paid more for not working than for working. The businesses didn't like that because they said it made it harder to attract workers to come back to work. But part of the problem is workers weren't, that we have such low wage work, right? That people are better off under unemployment, receiving unemployment. But putting that aside, right, there is a legitimate, I think, economic debate about what's the right level to set that supplement. But I think everybody agrees that some kind of an additional supplement from the federal government is necessary here. And I just hope that that Congress will be able to get through, and a lot of it's political, a lot of it's the problem being an election year, but we'll be able to be moved by the importance of this particular moment of getting through to some kind of a solution, right? And the longer it takes them to do that, the more that the harms are going to accumulate for these workers. I mean, again, if these are stressed households already who are paying a large amount of their income towards housing costs, if they run across unexpected medical expenses, I mean, they can be catastrophic for these families. And there is an impact on the economy as a whole too, because if you have people being evicted from their homes, if you have people who are, unable to work when they can't get the medical care they need, at some point that starts to damage the labor market. And we need a healthy, robust labor market in order for the economy to be able to rebound when we have the virus better under control. It's also the workers who most need this benefit, who are the ones who are going to be spending that money on necessities, right? It's not the fancy lawyers, I'll just pick on lawyers, right, who are working from home where it's going to make a difference. In fact, in terms of stimulating the economy, it's really the people who would most benefit from this, from the extended benefits, would also help the economy more because they would be spending that money right away and putting it back into the economy.
Absolutely. And at the beginning, when you were talking about the disparities, you had a graph and it showed, I think, white Americans compared to Latinx and Black Americans. And some students were wondering where Asian Americans fall on that graph. And in addition to that, wondering about gender inequalities and if those have been exacerbated or reduced during this pandemic.
Yes, so I don't have the exact numbers for Asian Americans. They're hard to come by, partly because it's a smaller population. My sense is that Asian Americans have not been hit as heavily by the trends that I had on that first or second slide there in terms of unemployment. But it's also important to keep in mind that lumping together the Asian American population can be a little bit misleading, and that often there are subsectors of the Asian American population, particularly recent immigrants, that the profile would look much more like the profile, for example, for Latinx workers. And so that there's a little bit of often a conflation if you look just at the numbers for Asian Americans. I'm sorry, there was a second part to your question.
Yes, gender inequalities, if they're exacerbated or reduced in the pandemic.
Yeah, so there's some differences across different groups among in the Latina population. Latinas actually took the biggest hit in terms of unemployment, more than any other group. They've also recovered somewhat. So a lot of it has to do with which jobs they're concentrated in, and if in different populations were concentrated in in different industries, some of them that were shut down and then others in these sort of high risk industries. One of the really big gender effects, though, has come from the closure of schools and daycares, which have hit women workers much harder because of sort of traditional norms in the home, which sometimes mean that if you have two parents at home, with kids. Mom's the one who's cutting back on the work time in order to take care of the kids. And then you have a lot of families that are female-headed households where the loss of childcare or the closing of schools has really had an impact on women workers' ability to continue working.
Absolutely. I think that's something that we're hearing a lot about, at least as academics.
Mm-hmm.
So I think that the situation you set up is problematic for COVID, but as you say, it's not just during this pandemic time that these issues are happening. So a lot of students were wondering if there are other countries that have dealt with these issues better, that we could be learning from, and if this, or if this is a pattern that we kind of see across the world, or if it's something associated with like the US system of capitalism and individualism.
Yeah, so it's hard to make a lot of generalizations. Other countries, particularly other advanced industrial economies, provide much more in the way of leave, paid leave, and a social safety net. So many European countries have done better in terms of having paid leave available if somebody's sick, leave available to deal with family care issues, and more generous unemployment benefits. Some countries even have a system where the government will if there's a decline in demand and an employer can't really justify keeping somebody on full time, there's some countries that have a system where they'll actually subsidize the employer in keeping the employees employed. Rather than requiring a severing of the employment relationship, the employee has to either be laid off or quit and then go file for unemployment. Instead, the idea is to try to maintain that tie between the employer and employee, but help to subsidize the employer through the period of time when there isn't really enough work for that individual to continue working. And there certainly are different models out there. It's hard to, again, there's so many different models, it's hard to sort of pick out one and say that every piece of it would work, but there are a lot of places to look in terms of developing better policy, I think. That's
great. That's good to know. We are actually running out of time, but I just wanted to ask, you've given us a ton of great information and I really appreciate it. Is there any last thing that you would like to leave for the students as we finish up here?
Oh, gosh. Yeah, I guess, I just would say that a lot of these policy issues are, they're very, they're technical and they're a little boring, but they're really important. They're really important to pay attention to because policymakers are making these policies, all of these things where there are who gets leave, who doesn't, who's covered, who's not, what the level of benefits are, how they're funded. And it's very easy to just sort of throw up your hands and say, it's boring, it's confusing, I don't get it. But the people who are making those policies are really creating the conditions for our workers that can be more fair or less fair, that can be safer or less safe. And so it's important as a citizenry that we are attentive to those things and are holding our public officials accountable for the conditions that workers encounter. And they should be able to work and get a living wage and be safe and be healthy.
That's an excellent place to end. I think that's really a great point, and something that we should all be working towards and supporting. So thank you very much. This has been wonderful. I really appreciate it. So thank you.
Thanks. Enjoy.
Okay, so have a wonderful day, everyone else. We are at the end of the second week, so I will see you next week. Have a good weekend and stay safe.